Typically for an LC2 screw, which starts at the level of the AIIS and goes posteriorly, a straight screw or a rigid screw is sufficient. However, in the setting of existing hardware, it's hard to navigate a rigid screw through the existing anterior or posterior column screws that may be present. The CurvaFix screw utilized in the setting of the LC2 corridor around existing hardware is a powerful tool. In this scenario, we've already placed our anterior and posterior column screws, and now we need an LC2 screw to go through the existing hardware. So we'll start with our views, and the first view we start with is our teardrop view. If you can go back to that first view that we had, roughly 30 degrees towards the foot and 30 degrees rolled over. This will give you the teardrop view, giving you an idea of where you're going to start your LC2 screw. And you can see here that you can see my wire. I'm going to take and it's a little medial, and I'll check that in a second. Shoot that one more time. Great. So I'm in the correct starting area, and you can see my teardrop there. There's a lot of hardware you have to look through. Now we're going to go to a rollover Jude. So, I'm sorry, a rollback Jude to show our AIIS and localize our starting point for our LC2 column screw. For the LC2 column screw, you'll see you can see my AIIS there, the anterior inferior iliac spine in the supraacetabular region, and I've got my wire directly on the bone. One of the issues with this wire is if you're too distal, you're inside the capsule of the acetabulum, and potentially, especially if you're doing an external fixator, can infect the joint. If you're too superior, the AIIS narrows and it's easy to fall off medially or laterally. And so you want to find an ideal starting point that allows for positioning of that wire. And so I've got this wire in place. You can see that I'm either medial or lateral because the wire looks like it's overlapping the cortex. Shoot that. And now you can see that I'm directly on the cortical bone of the AIIS. I'm going to take a mallet. I'm going to tap this wire in. Shoot that. Great. And you can see that I'm heading towards the sciatic notch, and I'll aim a little bit more proximal to that. Shoot that. And the beauty of this is I can navigate this wire towards the sciatic notch. I can navigate this towards the PSIS and take it quite long. Okay, now I'd like my view of my inner and outer tables. So you're going to come 20 degrees towards me and 20 degrees towards the head to show us those tables. That's the view that you had before. Okay. Okay, and come down the body. Excellent. You can see the tables there. You can see your inner and outer table. And so I can see that I'm heading in between my inner and outer tables. I'm going to manipulate my wire a little bit more so I'm more central. Okay, I'll take my mallet. Thank you. Shot. It looks like I'm able to get in between there, and I haven't hit hardware yet. Shoot that. That actually looks quite good. I'm between my tables. Can we go to the other view, please? Now, I don't need to go back to that teardrop view again. I just need the rollback Jude. The teardrop view, that initial view, just gets me my starting point in a rough location. After that, it's simply this view of the inner and outer tables, and the view, the rollback Jude view, showing the directionality of your screw going towards the PSIS or the greater sciatic notch or wherever you need to seat the screw to get good stability. And then pull back towards, yep, exactly, sorry. Shoot that. Great, and you can see I'm a little high there, but if I want to head towards the PSIS, which I can navigate to, I think that's really powerful. Okay, so now I'm going to use the 5mm drill. Because I've got some intersecting hardware there, I'm going to use the narrow drill to get started. Oh, before I do that, I do need to make a skin incision though. Yeah, that's usually a good idea. Thank you, sir. All right, so here's a small incision directly over the ASIS. Okay, great. I'll take the drill now, please. Yep. Great. And so there's a 5mm drill that allows you to get started. And if you have an area that's narrow, shoot that. Great. I can take this out now, and I'm going to use the obturator. Yep. Great. For the 5mm obturator, you have to preload the wire. I'm going to remove this. I'm going to insert my my wire. Let me give this back to you. Sometimes it's easier to get the wire inside the starting point and then insert the guide. There you go, now I'm in the bone. Shoot that. And now I can navigate this. Can I see the T-handle chuck? And I'm going superior there, so I'm going to turn this around. Great. I'll take that, tap this in. Shoot that. Shoot that. Great. Shoot that. Shot. And can you show me the other view now, please? Just don't hit my guide here. And so I'm going to try and navigate this wire into the PSIS posteriorly. Come down a little bit more. Yep. Shoot that. And you can see there my wire. Shoot that. Two medial. Shoot that. There it is. I'm in between my tables there. Shot. You can see it's bouncing off the lateral cortex. Shot. Shot. There you go. You can see it bounced off that lateral cortex. It's heading towards the PSIS. Can you show me the other view, please? So now I was able to navigate my wire between my anterior column screw and my posterior column screw. I was able to navigate my wire, at least on this view, towards the PSIS. And I'll check this on this view. Yep, thank you. Great. Can you, yep, keep coming, pull back towards you a little bit. Great. And I'm going to turn this so it's aiming a little posterior. Shoot that. Good. Shot. Yep, shoot that. That's a hard endpoint. Can you go to the other view, please? And so you can see that I'm through my LC2 corridor there. I've had bone the whole way. I was able to navigate between my implants, and hopefully this is sitting in the PSIS on this 20-degree rollover, 20-degree towards the head view. That's it. So I'm in my PSIS there. Now, in this case, I did not start with my opening reamer. As a result, I can take this out, and I'll have to ream with my ball tip guide wire in place. One of the important things to remember is that this ball tip guide wire is flexible, the reamer is less flexible. And so if you're not in line with the wire, it is possible that you can bend or even cut the wire with the sharp drill bit. So this maneuver, you do have to be careful that you are not aggressive and you stay in line with what you've drilled. Shoot that. Can you go to that rollover view again, please, so I can see how deep I am?
Sure.
Yep. Ooh, watch. And then, perfect, thank you. Okay. Okay, so now I'm hitting some hardware there, shoot that. So hopefully I can navigate. Can you push in towards me? Mm-hmm. Yep. All right, I'm almost there. Shot, I just got past it. There you go, and I can oscillate the wire out, or the drill out. Wire's still in. All right, I'll take the measuring stick, and then I need a reamer. Okay, that measures 100 and just over 130, at 132. I don't need to be all the way in the back there because my fracture may not extend there, so I'm going to go with 130, recognizing that we talked about this before, that the screw can get me an additional, at 130, an additional 10 millimeters. So 7.5. And I'll do a 7.5 screw here because I've already got some hardware there, and trying to fit a 9.5 screw with that existing hardware might be a little bit of a challenge. And so a nice 7.5 screw to split the uprights between the anterior and posterior column screw that are already there. Thank you. 7.0 reamer for a 7.5 screw. All right. Shoot that. I'm at my ball tip, great. Okay. And I'll take the exchange tube next, please. Thank you. And I will put this in, navigate this down the back, shoot that. Great, you can see my exchange tube in place. I'm gonna pull my ball tip out and I'll put this in. Look how easy that was. That goes in, shoot that. Excellent, I'm gonna take this out now and I'll take my screw. So let's put this in, let's see what happens. Good. And again, you can seat this LC2 screw in whatever trajectory is optimal for your fracture line. In this case, some of my screw trajectory was dictated by the existing hardware that was there that I'm trying to navigate through, but I also wanted to aim towards the PSIS. Shoot that. And you can see that screw is nice and flush. And now I can pull this out. Great. And I can take the locking mechanism. I usually, again, don't use a washer here because of the bulk. If you're looking for compression, you might consider using a washer. Okay, so now my guide is on. I've got my counter. And I can turn the knob. And now I've locked my screw. This comes off. I'll take the extraction handle, or the extraction screwdriver. And now you've got, shoot that, an LC2 column screw through intersecting hardware towards the PSIS. Go ahead and give me an AP pelvis now, please. Thank you. I'm going to give that back to you. And so you can see here that, again, lots of hardware, navigating various corridors, and even the most complex pelvic rings, you can get good fixation through these osseous fixation pathways that have been sort of drawn out in the pelvis. Push in a little bit more. And there you can see that screw safely in that corridor. Can you give me a outlet view, please? Excellent. And push in a little bit. Great, shoot that. Excellent, and then give me an inlet view, please. Great, you can see myself parked in that PSIS posteriorly. Push in a little bit, and you can see I split the anterior column screw and the posterior column screw in this image. So what you can see here is that we were able to navigate a screw down the LC2 corridor, able to bisect the anterior and posterior column screw, and be able to seat that LC2 screw in the PSIS. Obviously, the position of the LC2 screw can vary based on fracture lines and needs, and more often than not, a straight screw can be sufficient. However, in the setting of a complex pelvic ring or acetabular fracture, having the ability to curve the implant around other implants is really important. And the CurvaFix gives you that opportunity.